So GERD means that there is reflux or backflow of the stomach contents, be it food, liquid, acid, because the stomach produces acid, sometimes even alkali, backflow up into the esophagus, and that can cause damage to the lining of the esophagus. We bring awareness to the GERD around Thanksgiving time. As you can imagine, that's a time when we overindulge with eating and drinking and we are in a hurry. So that's a good time for patients to note that they have symptoms of heartburn or their reflux or GERD is getting worse, and that might bring them to their doctors to seek a medical advice. They may actually have chest pain, but we need to caution patients if they have chest pain, they need to seek medical advice because it could be their heart and we need to get that sorted out. They may have sore throat. Some patients complain of cough because the reflux of the liquid up into the esophagus may actually drain into their lungs, and they may have cough and wheezing. So somebody with chronic cough may want to seek advice about GERD symptoms. With the damage of the esophagus from the acid, patients may develop erosions and ulcers. They may develop strictures, so they may have difficulty in swallowing and pain on swallowing. That can lead also, with the damage from the esophagus, to Barrett's esophagus, which is what we want to bring patients to be aware of, because Barrett's is a precancerous condition and it can lead to cancer of the esophagus. Most primary care physicians might do a 2 to 4 week trial with the patient to see if they're getting better, and then refer on because the patient has failed that trial. And then we go on to do further tests. You know, we'll do the upper endoscopy. We have other methods by which we actually confirm that they're actually having reflux. We have the Bravo capsule, pH capsule, which will help, impedance studies and so on, which can help us to make the diagnosis. If you're overweight, you need to lose some weight, so that puts pressure on your abdomen. Take a smaller amount of food in quantity. Avoid spicy foods and citrus juices, chocolates, mints. During the Thanksgiving week, you want to use a smaller plate when you serve yourself. Forget about the juices. Decrease your alcohol intake. Stop smoking. All these things help the patient who has reflux disease.